Hello, everybody. I'm really excited to do this presentation. I've been thinking a lot about the topic. Just a little background with me. I've been a therapist for 35 years, and I kind of feel like at this point I've heard and seen it all. But one thing that comes up constantly in therapy sessions is bodies. And what about our bodies? They can be our best friend or our worst enemy. And um, the thing that I wanted to really focus on today is the correlation or the connection between our bodies and food. I mean, it's not like an alcoholic can just abstain from alcohol, or if you're a meth addict, you just don't call your dealer. Food is something that we confront every day, at least 3 times a day, hopefully. And it can end up being such a source of stress for so many people. Um, I just, I had a beautiful 10-year-old in my office not too long ago. And she came in with her mom. And when she sat down, we talked about, a little bit about herself. And then I asked, tell me why you're here. What is it that's bringing you in today? And she said, I hate my body. And her mom said, when Christmas came around, this is a 10-year-old, when Christmas came around, she was so stressed that she said at the beginning of December, I am not eating any sugar this month. And her mom just said, I was so alarmed when I heard that come out of my 10-year-old's mouth. This is a typical, normal, well-developed little girl who's prepubescent, by the way, and worried about food, worried about her body. So we're really going to get into that in this presentation. I think this is a topic that a lot of people relate to on numerous scales. I wanted to start off. So the name of this presentation is Why is Food My Constant Enemy? I thought of a lot of different clever names, but I think that really is a good title, because I think for some of us, when we reach for a brownie, we don't enjoy the brownie. We sit there and think, how many calories? Did I work out today? Is it okay if I eat this? How will I look tomorrow if I eat this? I mean, the kind of the dialogues that go on in our brains, I think, is just off the charts. So we're going to start off with just reviewing what we're going to be talking about today. We're going to talk about some stats. We're going to talk about connecting the body and food. We're going to review some definitions like body dysmorphia, eating disorders, orthorexia nervosa. Some of you may have never heard of that. And treatment. We're not going to talk a lot about treatment. That's going to be kind of just the end. Mostly what we're going to talk about is identifying what's going on with us with these different disorders. So I'm going to start off by just kind of sharing some general eating disorder statistics. People with poor body image are more likely to develop an eating disorder. That kind of goes without saying. Eating disorders affect people of every race, age, gender, identity, sexual orientation, and socioeconomic background. I don't care if you're in India or Germany or Kansas City. This is something that affects people of all walks of life. An estimated 9% of the population, or 2.8 million Americans, will have an eating disorder in their lifetime. I think that's a staggering amount, staggering statistic. 15% of women will suffer from an eating disorder by their 40s or 50s, but only 27% may receive treatment for it. So this is something that I think a lot of people do walk around with an eating disorder. And because it's not really talked about and because it's not really normalized that much, it's like, oh, I'm just got these quirks about food, but they're really not getting the treatment that they need. Interestingly, males account for approximately 20% of people with anorexia nervosa, 30% of people with binge eating disorder, and 67% of people with avoidant restrictive food intake disorder. I do want to say that it's difficult to treat eating disorders. I'm going to just personalize for a second. I actually had anorexia nervosa all through 7th and 8th grade, and I kind of have lived this. And from my personal experience, once an eating disorder, it's always kind of in your brain. I think that we know there's a biogenetic component to this. And so it's kind of a rigidity, kind of a rigid way of thinking. And it's not like when you treat it, the eating disorder really ever disappears. I think it's always going to be a part of something that we struggle with, but it's manageable and it is treatable. Fewer than 6% of people with eating disorders are medically diagnosed as underweight. Isn't that surprising? I think there's a stereotype that it's I don't know, the skinny models on the catwalk that are the ones that are anorexic. But really, we're realizing that fewer than 6% of people with eating disorders are medically diagnosed as underweight. Most people, in fact, people in larger bodies are at the highest risk of having developed an eating disorder in their lives. And among people with larger bodies, the higher the BMI, the higher the risk. Just take note of that. So it is the larger, more overweight individual that's more likely to struggle with an eating disorder. Anorexia has the highest case mortality rate, the second highest crude mortality rate of any mental illness. 10,200 deaths each year are the direct result of an eating disorder. That is one death every 52 minutes. That's pretty sobering. I know Karen Carpenter is kind of the poster child for those of us old enough to remember her. And I believe I think her biggest struggle was bulimia and not anorexia, but we do have people whose lives have been lost because of an eating disorder. Eating disorder suffers with the highest symptom severity are 11 times more likely to attempt suicide than their peers without eating disorder symptoms. Patients with anorexia have a high risk of suicide 18 times higher than those without an eating disorder. And the economic cost of eating disorders is 64.7% billion every year. Okay, now we're going to talk about body dysmorphia. Body dysmorphia is a mental health condition where a person spends a lot of time worrying about flaws in their appearance. And these flaws are really not obvious to anybody else. Experts think that about 1 of every 100 people has BDD. Men and women are equally affected. A family history of body dysmorphic disorder can be a contributing factor. So I had a mom who looked in the mirror and measured her thighs constantly. She had 6 daughters, and we saw that. So, and I think that happened with her mother as well. So when we say that a family history of BDD can be a contributing factor, let's be clear about something. We're talking genetic. It could be a biogenetic issue, but also very much an environmental or nurture component. So parents, moms out there, dads, be careful about how you talk about your bodies. Say positive things about it. If you are hypercritical about your stature or about the size of your thighs or, I don't know, the whatever, your children are going to be listening to that, and what they know that is important to you will become important to them. So if you have a nose you don't like and you talk about it constantly, and your child has your same nose, good luck, because that child isn't going to like their nose. So just be very aware of this environmental component. Be a big part of that. All right, so body dysmorphic disorder symptoms. We're just going to kind of whip through these. A preoccupation with one or more perceived defects or flaws in physical appearance that are not observable or appear slight to others. So this is something other people aren't noticing, but you are totally consumed by. At some point during the course of the disorder, the individual has performed repetitive behaviors, checking, excessive grooming, skin picking, reassurance seeking. Do I look okay? Do I look fat? Or mental acts, comparing his or her appearance with that of others in response to the appearance concerns. The preoccupation causes clinically significant distress or impairment, social, occupational, or other important areas of function. So maybe I don't leave the house because I'm so concerned about having a bad hair day. The appearance preoccupation is not better explained by concerns with body fat, weight in an individual whose symptoms meet diagnostic criteria for an eating disorder. With muscle dysmorphia, there's a clarifier here. The individual is preoccupied with the idea that his or her body build is too small or insufficiently muscular. Probably see this more in men than women, but it can happen with women as well. The specifier is used even if the individual is preoccupied with other body areas, often the case. So that's body dysmorphic disorder. Your body is your constant enemy. Okay, eating disorders. There are 3 or 4 that we're really going to focus on. The first one, I don't know how many of you have heard of this one, and I actually had a client that came in about 2 months ago that had this, and she had to tell me about it. I had never heard of ARFID, but this is avoidant restrictive food intake disorder. And I'll tell you, this client was a twin, which was fascinating to me. And the twin didn't have it, but she did. When I went to get her out of the waiting room, I said that she was a 19-year-old. So I went out and opened the door and looked for this 19-year-old. And I thought, well, she's not here yet because all I saw was one person sitting there who looked 12. So I went back to my office and waited a few more minutes and went back out there. And finally I asked if that's, are you so-and-so? And she said, yes. And I was very surprised. She looked very, very young. The body disturbance does not occur exclusively during the course of anorexia or bulimia nervosa. And there's no evidence of body dysmorphic disorder. There is no evidence of a medical condition that would warrant symptoms. What we do see is an eating or feeding disturbance. It's an apparent lack of interest in, I'm losing a word here, something or food, avoidance based on the sensory characteristics of food, concern about aversive consequences of eating associated with one or more of the following. So for this particular client, she lived on a diet of ramen and crackers. As fruit was aversive to her. She could not tolerate fruit. She didn't want any dairy. It was the look of the color of dairy and the texture of dairy made her throw up. There is significant weight loss or failure to achieve expected weight gains or faltering growth in children. Significant, what did I just do? Back, yep. Significant nutritional deficiency and a marked interference with psychosocial functioning. When I look, she showed me a picture of her twin sister who looked 19. And so this is very debilitating. And this girl had a lot of social deficits because of it, as you can imagine. Okay, bear with me. Carol, help me.
Go back the other way.
Carol's on with me for a reason. Okay, so what do I do? The back arrow next?
Oh, let's see. Which way are you going now? Okay, yeah, go the other way. Not that one.
Forward.
Yep, there you go.
Sorry, guys.
Doing great. Yeah, it's a great great understanding of what and how to just gain knowledge on some of these things.
Yeah, I mean, I think we've probably seen individuals who struggle with this, but to really know the symptoms and the signs, I think is important.
And I think the
Okay.
biggest one that we see is that last one. So that restricted food.
Yeah, we're going to get into orthorexia in a while, and that's really a big one as well. Okay, anorexia nervosa. So the diagnostic criteria for this one is these are the people that look like concentration camp individuals. They are just really, really thin. We've all seen them, maybe at a gym or maybe just in our neighborhoods, or maybe we had a class with them. Again, really debilitating. So restriction of energy intake relative to requirements, leading signs of low body weight in the context of age, sex, developmental trajectory, and physical health. Significantly low weight is defined as a weight that is not minimally normal, or for children and adolescents, less than minimally expected. Intense fear of gaining weight or becoming fat, or persistent behavior that interferes with weight gain, even though at a significantly low weight. So this is somebody who is very thin and is worried about losing weight. There's really no reasoning with them. There again. There's a rigidity to this particular disorder that is off the chart. Disturbance in the way in which one's body weight or shape is experienced, undue influence of body weight or shape on self-evaluation, or persistent lack of recognition of the seriousness of the current body weight. All right, bulimia nervosa. Bulimia is kind of opposite of anorexia because this is eating large quantities of food. So we have recurrent episodes of binge eating. An episode of binge eating is characterized by both of the following. One, eating in a distinct period of time within any 2-hour period, an amount of food that is definitely larger than what most individuals would eat in a smaller period of time under similar. There's a sense of lack of control overeating during the episode, a feeling that one is, bear with me because this is kind of cut off on the side here, that one cannot control what one is eating, or how much they're eating. There's also a recurrent inappropriate compensatory behaviors in order to prevent weight gain by self-induced vomiting, misuse of laxatives, diuretics, or other medications, fasting, or excessive exercise. The binge eating and inappropriate compensatory behaviors both occur on average at least once a week for 3 months. I think that's important because some people, I think, can get into kind of an episodic, kind of a small period of doing this kind of thing, but we have to make sure that we don't overdiagnose this if that occurs. We want to look and make sure that this is happening at least once a week for 3 months. The disturbance does not occur exclusively during episodes of anorexia nervosa. Then we have our binge eating disorder. The diagnostic criteria for binge eating disorder looks a lot like bulimia, but there are some differences, and these qualifiers are pretty distinct. So pay attention to this. There's a recurrent episode of binge eating, and an episode of binge eating is characterized by both of the following. One, eating in a discrete period of time within any 2-hour period, an amount of food that is definitely larger than what most people would eat in a similar period of time under similar circumstances. Now, most of you are probably thinking of what we all look like on Thanksgiving Day. And I think we could all say that we've been there at some point, but this is more of a pattern. There's a sense of lack of control, overeating during the episodes, a feeling that one cannot stop eating or control what or how much one is eating. I had a roommate with this, and it was very, very scary for her. She would buy a huge carton of ice cream, and then she would just eat the whole carton. And she knew that there was something that was wrong about this, but she could not stop. And I watched her struggle with this, and I know she could not stop. It was so distressing for her. The binge eating episodes are associated with 3 or more of the following. So pay attention to this. We're eating much more rapidly than normal. This is like just your face is in the plate and you're just inhaling your food. Eating until feeling uncomfortably full. Like, I think I'm going to vomit. I've eaten so much. And then still not being able to shut that off. It's just such a lack of control. Eating large amounts of food when not feeling physically hungry. I just finished dinner and I am plowing through a carton of ice cream. And I'm not hungry. I am just out of control eating. Eating alone, this was my roommate, because of feeling embarrassed by how much one is eating. You know, I'm in my bedroom, the door is locked. I have piles of food here. I have uh, empty packages of potato chips that I'm trying to hide. It's very embarrassing. And then, of course, feeling disgusted with oneself, depressed or very guilty afterward. This is where I don't even want to leave the house. And I feel so self-loathing. There is so much shame involved with this particular disorder. The binge eating, marked distress regarding binge eating is present. And the binge eating occurs on average at least once a week for 3 months. Again, we're looking at a continuum here. It's not just episodic. I think we've all done most of this episodically, but we're talking about this is going on and on and on and on like a runaway train with no brake. The binge eating is not associated with the recurrent use of inappropriate compensatory behavior, as in bulimia nervosa, and does not occur exclusively during the course of bulimia nervosa or anorexia nervosa. So that's an important qualifier to note. Okay, now we are getting to orthorexia nervosa. This is kind of my pet peeve, I guess. It's not an official diagnosis in the DSM-5-TR. So the DSM, of course, is every psychologist's Bible, every therapist's Bible. It's a big book that has all the different mental disorders in it. And orthorexia nervosa is not included in there. I actually think it might make it into the next revision. But a doctor named Stephen Bratman in California coined the term in 1996. It means fixation on righteous eating. And since then, many medical professionals have accepted this concept. Again, orthorexia nervosa. When I first saw that term, I thought orthorexia, when we think of ortho, we think of our bones. I don't know where he came up with orthorexia, but that is what we're calling this. And this is the criteria. There's excessive worry about food quality, which may lead to anxiety. So I have a friend that whenever we are at dinner, out to dinner, and she's ordering, she'll stop and say to the waiter, "Can you just tell me the ingredients in that salad dressing?" And the waiter will say, "Well, it's got da 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 da. It's got oil. It's got, oh, what kind of oil? Is it canola? Is it olive? Is it coconut? Because I don't do unclean oils." This is what this looks like. Avoidance of going out to eat or eating food prepared by others out of fear that the foods are not prepared by oneself won't meet the standards. This is also fear about how clean food is or if it's bad for one's health. And showing physical signs of malnutrition. These people sometimes look extremely thin. Burying oneself in food research and spending hours talking about planning meals. Refusing to eat a broad range of foods or dropping whole categories of foods in one's diet. Okay, guys, this is something that we see a lot, and I'm not going to really globalize this, but I do think our younger generation are kind of caught in this. I don't do gluten. I'm gluten intolerant. I'm lactose intolerant. Some are. I no doubt there are people truly who are gluten intolerant or lactose intolerant. I don't do sugar. I'm cutting out all carbs. And my first thought when I hear something like that is, truly, has it been diagnosed? And secondly, is this sustainable for the rest of your life? Is this just a fad? Is this because you read a report that said that gluten isn't good for your body? Again, I'm not talking about celiac disease. I'm not talking about some of these true diagnoses, but I'm talking about the narratives that are out there, the conversations that are out there right now around this topic. And it seems like there are a lot of them. And we have a lot of wonderful stores out there, like Whole Foods and Sprouts and Trader Joe's. There are so many great stores where you can buy wholesome foods. And more power to you. A lot of them are overpriced. A lot of them, you can find a lot of these foods in a regular grocery store. And so getting caught up in this, it's almost a religion for these individuals, that it's really what they think about, they breathe it, they talk about it. There is a fear of losing control and being afraid that eating even one meal not prepared by oneself could be a disaster. And then being overly critical, of the food choices of others. So I'm sitting there eating my food at a restaurant, and the friend across from me is saying, I don't know, I wonder if that chicken that you're eating is organic. Or I wonder if that's really a clean carrot that they put on that plate. It can be distressing for people eating with people with orthorexia nervosa, and it can be very distressing for people with orthorexia. I read a really great article just the other day in preparation for this presentation by Kimberly Wick. She is a licensed mental health clinician, and she wrote an article, 8 Warnings of Orthorexia. And she starts the article off by saying, guys, orthorexia is a big deal. And this is why. And I'm not going to say everybody who's concerned about eating healthy has orthorexia nervosa or is off their rocker. I'm not saying that, but I think those who are listening to me right now kind of know where I'm going with this. And this is what she shared. That in our culture right now, cutting entire food groups like sugar, fat, carbohydrates, and dairy are celebrated, encouraged, applauded. Oh, you look so noble. You look so healthy. She said, a lot of foods right now have been given labels of good or bad. And in reality, ask any dietitian, any RD out there, the first thing they learned in school is that there are no bad foods. Every food has a role. Even your junk food has a purpose. Maybe it's got a lot of carbs. Maybe those Cheetos are just exactly what your body needs right now. Maybe that's what your body's craving. Eat them, enjoy them. Maybe what you need is a quick burst of sugar because you're about to head off the ski slope and you need something. So again, she points out that we have to be very careful when we start labeling foods as good or bad. Let's just consider them food. It's fuel for our body. She said one of the dangers of orthorexia nervosa is that many of these individuals who struggle with it can be easily identified as health conscious or super, super healthy, when in reality, they might be suffering from malnutrition. Maybe they are not getting any dairy in their body, and their body needs that. They need that protein. And sometimes they're really dealing with very debilitating rigidity. This is kind of an OCD thing for them. And they've got this down to, I can only eat certain foods because I really do suffer from obsessive compulsive disorder, or I am very rigid in my thinking. One thing I want everyone to really pay attention to, and this was one of her final thoughts, was orthorexia is typically not driven by poor body image. This is not about, I think I'm fat, or I want to improve my muscle mass. It's entrenched in this kind of rigid need to be healthy. Again, very celebrated these days. We read about it, hear about it, and we kind of want to be the person who, oh, this is so great. You know, she's given up carbs. Doesn't she have great self-control? But if you think about it, your body needs carbs. All right, so to wrap this up, I want to think about changing the narrative about how we view our bodies. We talk about our bodies and we treat our bodies. If you think about it, all of us get one body, and that body is a gift. And it is the vehicle in which you experience life. So talk about your body with love and compassion, gratitude, everything you can to keep it healthy and strong, including fueling it with healthy foods. Embrace your body in all its beauty and imperfection. It belongs to you. I was thinking about this idea of cars. Whether you drive a 2024 Mercedes-Benz just straight out of the shop, or you're driving a 15-year-old Toyota Camry, both of those vehicles at the end of the day get you where you need to go. When you both arrive at the same destination, it's not like the person in the Mercedes can say, well, my car is better because it got me here. Because you can say the same thing. My Honda Accord is great because it got me here. It doesn't matter how those cars look, what kind of condition they're in, really. I mean, they're full of gas and they're well maintained. They're going to get you where you need to go. I hope we can kind of see our bodies in the same light. It really doesn't matter what our bodies look like. If our bodies can walk and see and hear and think and smell and taste and scroll through our phones and type a text and all the other things, the miraculous things that our bodies can do, then our bodies are enough. That's it. That's what we need, is something to get us where we need to go in life. And bodies come in all sizes and packages. And if we do what we can to keep them healthy and strong, and we don't focus on things about our body which we can't control, like our height or bone structure or the color of our hair or our skin, if we just celebrate that we have a body, I think we are going to be so much healthier. Do it in that kind of light. In his book, The Body Keeps the Score, many of you have heard of Dr. Bessel van der Kolk. He uses this term that I love, and it's called befriending the body. My body will be my friend. And he suggests noticing and describing the feelings in your body. Like maybe not, we're not talking about the feelings like anger or sadness or anxiety, but really the physical sensations in your body, like pressure and the heat, or a tingling sensation, or muscle tension, or cravings that we get. And recognizing that they are signals in our bodies. And if we befriend our body, and if we look at it as something that is informing us and helping us, what a different life we could live, and how much better off we would be in making peace with our bodies. Okay, so I said we wouldn't focus a whole lot on treatment, because I wanted to kind of just give the nuts and bolts of what these disorders look like, but treatment is key. And so let's look at what that looks like. Treatment plans for eating disorders include psychotherapy, medical care and monitoring, nutritional counseling, medications, or a combination of these approaches. Typical treatment goals include restoring adequate nutrition. Bodies do recover. I think my body's really healthy, pretty healthy right now, and it did not look that way in 7th and 8th grade. But I did overcome my anorexia, and you can too. Whatever eating disorder you might be struggling with, you can recover, and you can have a very normal, productive, successful life. I want you all to know that. There is so much help out there now that wasn't there when I was struggling with. And so to take advantage of that is key. We're also looking at bringing weight to a healthy level. And healthy, gosh, healthy is going to look different to one person versus another person, perhaps. Can we just also understand that body types are all different? So if you have a particular body build and you're 5'5", 150 pounds might be your ideal. Or if you have a different body type, your ideal might feel like at 5'5", 130. We don't necessarily want to get into numbers, but be aware that your bone structures are different and your bodies are built differently. And that factors in when you're looking at a weight or a number. Also, reducing excessive exercise. How many gyms are out there? How many gym memberships do people have? And there are so many things that we can do to keep our bodies healthy, and exercise is key. I am a very big proponent of exercise. I love to exercise. But I know that my body will not exercise 7 days a week. That is not going to happen. I exercise, what works for me is I exercise on Mondays and Tuesdays, and I take Wednesdays off. And then I do Thursday and Friday, and I don't even touch the gym or do anything on weekends. Maybe I go for a walk. But I know what works for me. You're going to know what works for you, and you know when it's excessive. I think you can tell when you are in that place where it's no longer healthy, it's no longer fun, it's no longer refreshing and restorative. It's more of a chore. You know when you get to that point. So be very aware of excessive exercise and tone it down and pull back. Stopping purge and binge eating behaviors are also key. Making sure that if that's happening, seek treatment. I know that in Salt Lake and Utah, where Carolyn and Heather and I are, we have several places that address just eating disorders. One is called Center for Change in Orem. I'm sure that I know they're all throughout the nation. But these are really very helpful treatment facilities for people who are struggling with an eating disorder or some type of body. I think that wraps us up. So we are going into questions and answers.